Hi, I'm Sebastian Mabatin, and I am doing my HSC2000 project on registered nurses. So the scope of practice for RN would be pretty broad. As you can see here, we have things like observation, evaluation, diagnosis, intervention, evaluation of care, teaching, counseling, health maintenance, wellness, prevention, administration of medications, treatments prescribed by physicians, and teaching of other personnel. So it's a very broad scope of practice, and these aren't something, not everything will be used in the setting that you're in. For example, if you were in the hospital setting, you would be mostly using observation, evaluation, and diagnosis, possibly intervention, and medication administration of medications would be a big thing that you would have to do. But if you're in a clinical setting or in a home health setting, possibly wellness and prevention, health maintenance, observation evaluation as well, but to a different degree. So a scope of practice for a nurse is pretty varied and broad. Now, what do nurses do every day? Well, mostly hands-on patient care, monitoring, as well as maintaining patient records. Hands-on patient care are things like administration of medications, IV lines, temperature, changing positions of a patient to prevent bed sores, things like that. Monitoring patient conditions and maintaining records go hand in hand. So monitoring patient conditions is, for example, you hear nurses say about doing rounds, so mostly just checking in on patients every now and then. So monitoring their temperature and just overall feel of the patient. And then maintaining records is simply put paperwork, which is used and seen by the primary care physician or whoever is wherever you are or on the hospital floor, and it's checked by, I think, the chief nurse. So who works with RNs? Mostly doctors, CNAs, LPNs, and other RNs. So this varies between hospital settings. For example, if you were at Florida Hospital, you would work with all four of these. But if you're in home health, you would probably work with just an MD and an LPN or one other nurse. It's very dependent. And if you're in a nursing home, CNAs and LPNs would be people that you would be working closely with side by side. So workplace setting, pardon me. It's I've mentioned this before in the first four slides. Outpatient, you have your outpatient clinic, which is things like Central Care or Minute Clinic, and then you have your hospital, your care facilities, and your home health. So care facilities are things like Plantation Bay Nursing Home or Orlando Regional Medical Center would be a care facility, as well as any assisted living community, things like that are care facilities. And then we have your home health, which is a company that will contract you out and send you to different patients' houses or homes, and you will treat them accordingly depending on what they need, maybe administration of medication, changing oxygen tanks or something like that. It varies. So we have this question is, where can I work if I was a nurse? So anywhere in the U.S., and it can be specialized or it could just be your general RN, things like an SSS, ICU, OR, ER, trauma center. It's varied. And working anywhere in the U.S. provides you a great flexibility. You can go anywhere and have your, just as long as you're licensed and that license is accepted in that state, you should be fine. And then these are the degrees needed. So a bachelor in science and nursing, that's a 4-year degree, with the last 2 years being an accelerated program that focuses on the clinical scene. So clinical scene meaning time in the hospital. Then you have your state licenses, which is just passing your NCLEX exam, and then getting registered. Now, supervisor is this is the hierarchy for nurses. So the chief nurse is the CNO, he's the head, followed by the house supervisor, who works with staffing, transfers, more administration on the leadership level. things like who works when or who works where. And then you have the Director of Nursing Services, which is budgeting, administrative works, accounting, mostly reports to the CNO. Then you have your nurse manager, who does day-to-day responsibilities. That's who you would be reporting your monitoring of patients to, or anything that's happening on the floor. You would probably report to the nurse manager. And then licensing. So to be a Florida registered nurse, you'd have to take the national exam, which is called the NCLEX, and or a nurse licensure compact, where about 50% of the U.S. is covered by the NLC, which means anywhere you go, depending on what state, 25 out of the 50 states, 25 will be covered by the NLC, meaning you can practice there without having to take a state license. So boards and exams, you have your NCLEX to be an RN. It's a pass-fail type test, and it's a state board. So if you pass your NCLEX, you are nationally recognized as a registered nurse. Here's some education requirements. Again, this is a bachelor's in science of nursing, 4-year degrees at an accredited school. Some states will require clinical hours, while others will not, because it would be built into the system. And then 2 to 3 years if you're doing the RN to BSN route, and most of it is online. For the majority of the Florida schools, RN to BSN is an online program, and USF has a 100% acceptance rate for RN to BSN. And then continuing education. Continuing education just means staying up to date with the current events and topics that are happening in the healthcare world. So 24 hours of continuing education for every renewal period is required for nurses, 2 hours of medical prevention, and 26 hours in domestic violence. And here are just some professional organizations that are associated with nursing, things like the American Nurse Association, International Council of Nurses, and American Academy of Nurses. And here are just some of the things that I pulled that I used for this slide, and yep, that is about it. Thank you, and please enjoy.